Welcome, everyone. I know we have some people who may be continuing to join us over the next few minutes, but we want to be cognizant of everyone's time. We know it is limited and valuable, so we want to get started as quickly as possible today because we have a wonderful conversation on tap. Welcome to Integrate Online. It's presented by West Virginia University Reed College of Media, which offers renowned online master's degree programs in marketing communications. Thank you so much for joining us today. We're going to be discussing pivoting in higher education amid COVID-19, a subject that we are all too familiar with right now. And we're joined today by two great professionals who have a great deal of experience in this area. Jack Martin, the Assistant Vice President for Communications at the University of Washington, as well as Sharon Martin, the Vice President of University Relations and Enrollment Management at West Virginia University. My name is April Call. I'm the Director of News at University Relations at West Virginia University, and I'm going to be serving as the moderator for our discussion today. I'm also a graduate of the IMC program at the Reed College of Media and a graduate of the former Burley Isaac Reed School of Journalism at West Virginia University. So I'm really happy to be able to moderate this conversation today and talk about what has become such a pivotal topic in higher education, particularly when it comes to communicating what's happening on our campuses. So keep your mic muted if you could, unless you're speaking today. That'll help everyone be able to hear a little bit better, and I think that's important. And we do, however, want this to be an open conversation. So if a question, you can include it in the chat or raise your hand, and we'll make sure we get to you, and as we are able, answer your questions. And for those that we don't get to, I'm sure we'll find a way to try and get those answers to you as well. So unless anyone has any other questions, I'd like to jump right in. And I'm going to start, Jack, with you, and my perfect timing there as you're taking a drink. I must have been a server in my former life. I wanted to talk with you a little bit because the first confirmed cases in the United States happened in Washington State. So your campus really was the front line for making decisions and communicating those decisions. So walk us through what that process was like and what those early days of communications and decisions looked like for your campus.
Yeah, absolutely. And first I want to thank everybody for joining today, as well as for the important work that you're doing to keep your communities informed. Information is one of the best weapons we have at the moment against the coronavirus, as we wait for treatments and vaccines to come online. And so your job is vital for your communities. And so thank you for all the long hours and that you're putting in to this effort. For us at the University of Washington, this really started to come onto our radar in January, late January, when we had some students come back from China and receive tests for the coronavirus because of their symptoms and because of their travel history. And so most of the month of February was spent in kind of a monitoring mode where we were, keeping an eye on the public health situation, issuing more and more restrictive travel advisories, and then finally travel bans. But it really didn't all come together until February 29th, which was when there was the first death in the United States. It was a person at the Life Care facility in Kirkland, which is across the lake here from the University of Washington. And on that day, our president, Anna Markause, sent a message to the university community, letting them know that, this was in our community now, there was community transmission, and that we were taking appropriate steps. It was our hope that we would be able to get to spring break, which was a couple of weeks away. We're on the quarter system, so this would have been finishing up our winter quarter. But by March 5th, so later that week, it was becoming clear that due to community transmission, we needed to move to remote instruction. And so we worked with our university leadership. Several of us were in the office until midnight that Thursday night, planning for an announcement that following Friday that for the last week of instruction and the finals week, we would be going remote, and that we would plan to come back for spring quarter on March 30th. As it happens, the New York Times learned about those plans, and so we moved up our timetable to a 7:30 a.m. Announcement, and they respected our need to inform our community first. At that point, we had already established uw.edu/coronavirus as a central information source, and that has exploded both in its own content and in the creation of a number of other FAQ pages for spring quarter, for employees, because as I mentioned at the outset, information is key here. And in a time of just real uncertainty for our community, they're looking for answers. And so we've seen our role as one of trying to provide answers to folks, even if the answers are not popular, such as we're not going to refund tuition, or commencement's not going to be able to be held in person this year. And so, you know, we have had those probably first 3 weeks of March were just really intense, you know, every day, 7 days a week. We were there, you know, trying to deal with just a series of decisions. How do you announce those decisions? But as I've told folks, eventually you run out of things to close and you run out of decisions to make. And so, you know, we've kind of settled into a more sustainable mode here. We did make the decision in late March that based on public health trends, it was not going to be feasible to come back in person for spring quarter. And so we are remote, not only for our spring quarter, which ends in mid-June, but also for at least the first half of our summer quarter, which will take us up into July. At this point, a lot of the questions are starting to be around fall and what our plans are for the fall. Those are still being discussed. You know, we're fortunate to be home to the Institute for Health Metrics and Evaluation, which has been doing the national and the state-by-state projections for deaths and for hospital resource usage. And so we do have just some fantastic experts here who can help us predict the course of the pandemic. But as we've all seen, that's a very difficult task. And there's a lot of uncertainty even in those projections. And so right now, we're just trying to keep our community informed and let them know that we don't have all the answers yet, but we know they're looking for them.
Sharon, I wanted to pull you in. Speaking of expertise, West Virginia University, along with a lot of other institutions, have been approaching communications and those decisions that they've had to make in a variety of ways. And at WVU, our Vice President for Health Sciences, Dr. Clay Marsh, has sort of put on two hats. Not only is he doing the work that he does at the institution here, but also has been named West Virginia's COVID czar and has been one of the primary people advising the governor and his staff. How has that affected or influenced the way that decisions have been made on the WVU campus, and how has it changed the responsibilities and some of the workflow that we've had here on campus?
Sure, thank you, April, and want to echo Jack's thanks to everyone for joining and for having us here today. It has been, I think, a godsend to have Dr. Clay Marsh on our team as we watch things happening out in Washington and seeing what was transpiring there. He was also watching what was happening in Italy and across the world, and was able to bring to our table not only what was happening in the US, but how things were going to progress if we didn't make some changes fast for West Virginia. And so he has been a close confidant of the governors and the public health workers and teams across the state, and really helping us to understand what the consequences are if we didn't act fast. And so that's been able to help us as a university make some of those decisions on a faster timeline. I remember we had a meeting on March 4th when we were looking at what was happening in Washington and across the US, and thinking, well, we may get eventually to this state of emergency, but we're not sure when or if, and 14 days later, everything had shut down. We were all teleworking and everything transpired really quickly. So to have Clay at the table informing us from a medical perspective, what we can anticipate and what we think might happen, helped us to inform how to protect our students and our staff and our faculty. And so being able to really lean on him has been invaluable. And then I think from our land grant perspective too, we've really taken that to heart of helping bring all of the resources that we have from a research and medical perspective to the state. And so being able to set up testing, being able to help communities understand how they could get their hospitals ready, having WVU and WVU medicine involved with that has been really important in helping us to keep the spread down as much as we can.
Let's jump on that topic for just a second, because I think from two different perspectives, Jack and Sharon, you both have mentioned expertise, and the way that has helped to inform the decisions and then the communications that you've been sharing. And that's something that every campus has the ability to pull from. So let's talk a little bit, Jack, I'll start with you. In terms of UW's chart and tracking and that expertise that you've been able to bring to bear, how were you able to get that pulled together quickly? How have you used that, as well as your other experts on campus, in your marketing and other communications to help keep people informed? Since, you know, as we've all kind of talked about, keeping people informed has been the number one priority, along with keeping people safe.
Yeah, so we're fortunate that we have just a tremendous strength in all of the health sciences, as well as in a field called population health, which looks at how do you address health and well-being at a community and even national level. And so, you know, we were able to draw on those strengths very quickly. We also have tremendous strengths in virology, and you know, the reason we were able to detect that coronavirus was spreading in our community sooner than other communities was we were running the Seattle flu study, which was a collaboration here, and many of our scientists were concerned about the possibility of community transmission, and so had retooled some of their testing in the Seattle flu study to be able to detect coronavirus, and they were the ones who were able to announce that it was spreading in spite of, you know, what were pretty restrictive requirements put on them by the federal government. We also, you know, I mentioned Institute for Health Metrics and Evaluation. That's a center that on an annual basis has published the Global Burden of Disease, which looks at all the factors that affect people's health and well-being on a national level and even a subnational level. And so they were able to very quickly tool up to provide these projections. But, you know, as you mentioned, you know, it's not just the health space that our universities have strengths in. And, you know, we have faculty with our Center for an Informed Public, which is intended to fight misinformation and disinformation. And we've seen a fair amount of both during this crisis. And so they're out there commenting both on disinformation campaigns that are being run by state actors to, you know, simple just bad graphs that misrepresent the data and give people a false sense one way or another. But there's folks in psychology and sociology studying what social distancing does in terms of increasing people's isolation and depression and anxiety. And so, you know, as we look at the ways that our university is contributing to this, you know, I think this would apply to all institutions where you have faculty who are there, who have expertise that's applicable. It's just a matter now of both telling that story yourself. We've done feature stories for our website and for our news team about this faculty expertise, but also then have been helping make connections with media, international, national, local, so that they can have these experts to, you know, to refer to in their stories. We've also seen that through polling, both by Edelman and by the Association of American Universities, that academic experts are some of the most trusted you know, spokespeople, you know, in the country and in the world right now. And so this is just a perfect opportunity for us to use the expertise that our faculty have across disciplines to contribute to the response to this crisis.
Jack, I'll interject just a quick moment, because this happens to be the area where I've been working most closely with our team at West Virginia University. And a few of the things that we found to be really helpful is our team created a Google document that we all work from, and it's sort of split into sections where we have new ideas, things that are in process. We have news releases, expert and story pitches that are going out. We, you know, sort of plot out where should they be targeted, what should the timing be, And like you mentioned, we've touched on everything from social distancing, anxiety, substance abuse disorders, and how they can be heightened during a time like this. We just put out a news release this morning related to the potential that this could be an opportunity for police departments to reevaluate their processes in communities where community policing has maybe been a hot topic in recent years, and sort of reset that relationship within communities. So we've been very fortunate that we've been able to tap into some of those faculty and other campus experts. And we've found that the response, like you, has been tremendous. The news media in particular is hungry for these sorts of ideas that they can then take and run with, for insights and expertise, historical perspectives that they might not otherwise have the opportunity, especially as their work has changed in being able to go out and report in person and interview people. The more that we've been able to provide for them, the easier we've been able to make it for them. The more pickup we've seen in a lot of those areas. Sharon, I wanted to ask you, beyond sort of the news expertise, how and what do you think has been most effective in terms of the marketing and staying true to the strategy? There are lots of tactics that are being used, but how do you marry that strategy that's sort of overarching for the institution and the brand of the institution, with having to use the tactics in this very specific situation?
Yeah, that's a really good question, April. And I think that the way we've approached it really is we've divided communication into really two broad segments. And one is all crisis and information communication that you all talked about. But then there's also the communication of connectivity and just remaining connected to our institution. And we're definitely an institution that thrives on being having outreach and making those personal connections and really being able to develop a good relationship, which is sometimes difficult when you're not able to bring them on campus and show them the love, if you will. So we've worked really hard to figure out ways that we can still have people connect back to either the university that they're attending or that they work for or that they were hoping to attend come fall. And, we've done some things, we've taken things that are traditional to us or have deep meaning to us, like our country roads theme song, if you will. A few weeks ago, we did a great social video where we had different WVU West Virginia celebrities sing a part of that song, and then we aired it on social right after the NCAA had rebroadcast one of the men's basketball games. And so having that connection back to the university and to the people and just to the community that we are has been really important.
How have, and Jack or Sherry, this is for either of you, given the fact that this has moved so quickly, and especially in those first 3 weeks to a month, it sort of felt like a breakneck pace. How do you keep the teams motivated? How do you keep people from burning out? What has worked for your teams? And moving forward, since we know we're probably still in the first quarter of this, what are you thinking as you look ahead in terms of avoiding burnout and fatigue?
Yeah, for us, it's been about rotating staff. We have a coverage calendar where, we say, okay, who's on point for issues and for updating the FAQs today? Who's on point for this on social? If we have to send a mass email, who's our news contact on the media relations side? And just trying to get people a break. Those first 3 weeks, it was pretty much, it was 7 days a week. And we really quickly learned that we were going to burn ourselves out if we were all working all the time. And so we've instituted a coverage calendar so we can try and rotate through. We've also seen this as an opportunity to bring in folks whose jobs right now are very different, and they may have extra time because maybe they're on the events team and there aren't any events right now, or maybe they're in a part of communications where there hasn't been this ramp up. And so it's also been an opportunity to get some people additional experience and see this as a professional development opportunity that in normal times they may not have had.
Yeah, and I would say, April, I worried about burnout when we weren't in this situation, right? So this is just layered on, I think, some of those concerns. But we've really talked a lot about making sure that they take time for themselves, that they step away from their computers. I think we've all found that it's really easy to sit at home and not get up and move as much. And so we really want to make sure we do that. I've really encouraged teams to take the weekend, shut things off as much as they can. And I'll text if we have to get back together. But it is a concern because, to your point, I think we're just at the tip of this, and it's going to be going on. Whatever the new normal is going to be is still going to be an exhausting new normal to a degree. And we have to just make sure that we preserve those energies. And I think, making sure that, to Jack's point, of bringing in other people who may not be in the fire as much right now and seeing what they can take on as well, or what new skill sets they can bring to the table, has been really important too. But really, it's just a reminder to take self-care and to take some breaths and pace yourself, because it's going to be a marathon as a sprint at a sprint's pace, is what we've been calling it.
I want to go back just for one brief moment to talk a little bit about experts at West Virginia University. And Jack, you may as well be a member of the conversation.
Mm-hmm.
I couldn't remember, I thought you were.
Yeah,
and for those who might not be familiar with the conversation, it's a platform that utilizes academics to talk about topical events and other issues from an academic and research-based standpoint. These aren't op-eds. It's basically articles that are written in a news style for a lay audience, distributed through the conversation, but also they have partnerships with the Associated Press and a number of other large publications all across the country and the world. And that's been a platform in terms of tactics that we've been able to utilize for some of our experts, and I know you have as well. But I wanted to get back to the question, Jack, that you sort of raised related to trust, and the fact that in a time like this, we are seeing a resurgence of people looking to college campuses, to academics, researchers, scientists for information and guidance. And it's no secret that higher education on the whole has suffered a bit in recent years in terms of its brand, and people thinking perhaps it wasn't as relevant to their day-to-day lives. And I'm curious from both of you, and Jack, I'll let you weigh in first, how do you think that this crisis may affect trust and that feeling of relevance for higher education as we move forward? And how can we as communicators on campuses leverage that potential positive for the future?
Yeah, so I think that on balance, this will be a positive for higher education in terms of our ability to regain some of that trust that we've lost, along with many other institutions. There is some downside risk, and I'll talk about that in a moment when it comes to our brand promises and our ability to maintain those in a remote learning environment. But I do think that as you see on a nightly basis or daily basis, you have university experts in the media, on social media, commenting, providing their expertise. Sometimes they disagree. We have faculty at our own institution who have raised questions about some of the projections that other faculty are making. That's all part of the academic process. But I do think that, particularly as we have this hunt for treatments, hunt for a vaccine, universities are central to developing reliable therapies and vaccines for this disease. And I think that right there will be a major boost to people's trust in higher education, as long as we're able to demonstrate that connection with our medical centers and with the medical research side. Now, on the potential downside, I do think that as we look at the potential for remote fall semesters and quarters, there will be growing pressure from families and students for some sort of rebate, compensation, what have you, if we're not able to demonstrate that we are maintaining the quality of education that they expect. And so one of our areas of emphasis here as we've come back for spring quarter is about focusing on stories that talk about the quality of the academic experience. We're working on one for next week about how our STEM fields are shipping course materials for free to students so that they can do experiments and do the same sort of activities at home that they're doing, they would be doing if they were on campus. And so I think our ability to uphold our brand promise and uphold the belief in the quality of our education is going to be vital to ensuring we don't experience that downside when it comes to trust.
Sharon, what about you?
Yeah, so I would echo what Jack has to say, that I do believe that because we've been able to put so many of our experts out there and share different discoveries or research that's going on, it has helped develop that trust back with our public, which is then turned into heightening the value of what higher education can bring. But to his point as well, there is a difference in what people perceive of online learning and learning on campus. And I think people need to remember too that what we're doing now is a very quick flip to online learning. It's not what we would have created had we had the time to create an entire course for the semester with the proper time to flip everything in a week and a half. It was going to have a few glitches here and there. So I think if we do have to go to a fall learning semester where everyone is online, we really have to take the summer to be able to prepare those courses so that they are getting an equivalent of what an online learning environment would look like with the proper time to develop. So it's an interesting time for sure.
I'm sitting here thinking, we're in this platform, we're talking about this as part of Integrate Online, which is related to IMC's program at the Reed College of Media, which has been one of the most successful online programs in the country for marketing communications. And I know I see Chad there, Mazzara, and I know that the team at the Reed College can speak to developing a robust and very fulfilling online experience for students. But to your point, Sharon, this isn't a typical situation. We've been asking faculty on all the campuses to transition very, very quickly from a more traditional delivery system into a lot of platforms that some of the faculty and staff may have had no experience with previously. So it's been a learning opportunity for everyone, I think, in a lot of ways. And I do think that there is the potential that we're going to see a lot of changes to the way education is delivered in the future. And so, Sharon, I'm going to come back to you on that one, because I happen to know that our president, Gordon Gee, is very involved in thinking about what higher education in the future is going to look like, particularly as it relates to land grant institutions. And so I have to think that this has spawned conversations around the kitchen table, so to speak, about what this might mean for higher ed as we move forward.
Yeah, absolutely. And I think one of the things that we've tried to message is that this particular time, it's alternative learning. It's not what we would consider a true online course. And so if we look to the fall and we are going to be more online, we're hoping to develop those courses as you would get in a typical online platform. But to your point, yes, Dr. Gee has been both excited about the opportunity. He's also struggling. He's a social person, so having to social distance for him is a little hard. But I think the one thing that we've all seen is that traditionally higher ed moves at a somewhat slow pace, but we flipped a lot of things really quickly. And did they all go as perfectly as we wanted? Maybe not. Would we have done them differently if we had more time? Maybe so. But the idea that we can change the way we do things, or that we can add layers to what we're doing, has become really obvious. So for an example, we always had two awesome online or on-campus open house days where the students would come, prospective students would come and spend a day with us and really learn about who we are. Well, we flipped all that to a virtual model a couple weekends ago. And what we learned is that actually that was a really good platform that we're going to continue even as we're able to come back to campus, because a lot of questions were answered beforehand. A lot of stress was taken out, being able to connect with them one-on-one, and then being able to bring them to campus to experience what is WVU is going to be really important and exciting. So we've discovered some things in this uncertain time that we can continue to do some of these virtual modes of delivery even when we're able to be on campus, because it adds an extra layer of just connectivity in a disconnected way that I think is kind of exciting. So yeah, I believe, from the president's perspective, he's seeing that there's opportunity in this, that we can perhaps look at how we deliver education how we can connect with each other and how we can continue to communicate and recruit in new ways that maybe we hadn't thought of before.
Jack, how have you looked at moving perhaps events and other planned activities into that virtual space? What are some examples that maybe you have, and what things are you planning for the future?
Yeah, so I think one of the things we even just talked about with our leadership team in marketing and communications yesterday was we want to banish the idea of a virtual event, because virtual implies that you are somehow replacing and having the exact same experience that you would have if we were in person. And we're finding that that's just not possible. We can't have our annual donor recognition gala and our beautiful Suzzalo Library reading room, which looks like Hogwarts, and have that virtually. It's just, we have to completely reimagine how we are having these community gatherings. And so that is exciting. It's a little daunting, for an events team and for really a broader marketing team that has really invested in these in-person high-touch experiences. How do you maintain that level of connection? How do you maintain that level of stewardship in a situation where we're all on Zoom or on whatever platform that we're using? And so as we have thought about how to go forward, we really tried to not say, okay, we are just taking this event and we're moving it online, because you just can't do that. And so that provides an opportunity, as Sharon was talking about, to really rethink how we're approaching a lot of these different activities, and to get back to the basics of what are we trying to achieve here, and how can we achieve that using the tools that are available to us now, if these other tools such as in-person events are off the table for the moment.
So let's talk a little bit about some of those tactics, and as it relates back to that overarching strategy of why are we here, what are we trying to accomplish, and who we are as an institution. How do you keep connected to those key constituencies? And in particular, Sharon, talk a little bit maybe about some of the efforts that we've done here at the university to connect with parents as one of those key groups, because I think we learned very early on that we really, really needed to be sure that we were engaging with our parent and family community a lot.
Yeah, absolutely. They're a key constituent and key partner for us and for every institution. And so keeping them informed is really important. I think, in the beginning of that crisis, we had several special e-newsletters that went out to them, explaining exactly what was happening for the university. And those went out to both our current students as well as our prospective students' parents. And so it helped them understand what was happening. And we closed or had sent messaging out to all of our students right before they went to spring break. So they knew that they were leaving for spring break. They should take everything that they can with them. They were going to go online for at least a couple of weeks when we came back, and then we would evaluate later. So the parents knew that messaging, and we were also asking them to help guide their students as to maybe what their travel plan should be as they headed out, and perhaps they should return home, maybe not go on spring break if they could convince them to do so. But we tried to help educate the parents as to what was happening so that they could have those honest conversations with their students as well. And then throughout this whole time, we have continued to communicate with our parents and let them know, every step of the way what was happening so that they could also inform their student. We're working with Dr. Gee right now to take a message where he's going to give some tips to our parents. A lot of students are now back at home and trying to live the college life and study for college courses in a home environment, which is very different. And so trying to give our parents some tips on how to acclimate them back into that. So it's been very vital to keep them all informed and engaged as much as we can.
Jack, what about you? How have you engaged with the various constituencies that you need to stay connected with?
Yeah, for parents, every time the president sends a message to students, our head of parent and family programs will forward that message with a cover note from her to our parent and families list so that they receive it not only forwarded or interpreted from their students, but also directly from us. But we've really put an investment into social media. part of that coverage calendar is ensuring we have folks who are monitoring our channels and are able to answer questions, 7 days a week. But then we've also gone to just some, basic old school outreach, calling people on the phone. Our admissions folks, now that they can't do visits, just been calling all of our admitted students. They called all of the high school counselors to talk with them about, what our plans were, and also to get feedback, to get their sense of what they were hearing from their students, which informed some of our decisions around outreach in that area. And it's also, we're melting down our email servers with as many mass messages as we're sending, which is not it's not the best vehicle, but people are reading it. We can look at the engagement rates, and our weekly UW Insider newsletter that goes to faculty and staff every Wednesday is getting the highest engagement rates it's ever had. President's message, the provost's messages are easily clearing 40% open rates among faculty who are notoriously tough to get to open their emails. And students are I think we had 82% of our teaching assistants open the message from the provost last week. And so, people are hungry for information. They're hungry for that connection. And so, we've been trying to, maintain that to the extent that we can. We're looking for how we do larger scale, not events, but larger scale opportunities with our president. Some sort, probably not a Reddit Ask Me Anything, but something where she is on video and can answer questions. And then just internally with our team, we're having, as I imagine many of you are, virtual happy hours. We're having, town halls with all of advancement every couple of weeks, because we just don't see each other around the office like we used to, and people are just hungry for that connection.
One of the things I wanted to remind everyone, if you have a question, please feel free to participate, maybe drop it into the chat section. I've put in a few resources that we've already talked about. Sharon mentioned WVU's Country Roads post that garnered, I think it's now over 1 million views. And I've put a link to that from the Facebook post if anyone's interested in checking that out on their own. And then also, Jack had mentioned their facts and resources and some of the information that UW's posted. So I shared their facts and resources page, which also has links to FAQ and some other things, as well as West Virginia University's coronavirus.wvu.edu link, which then links out to a variety of other sources that has all kinds of information. We're talking about reaching various constituencies. Going back to some of those basics like phone calls, emails, websites has really been critical, I think, for a lot of those institutions. But I think also finding those ways to stay connected and engaged. And so I'm curious about how you keep your teams engaged as you're working remotely from various locations. You can't pull everybody, just like you can't pull all of your prospective students into one physical location. You can't pull your entire communications or marketing team into a physical location. So how are you finding ways to keep people connected to campus and then keeping people connected to each other? And I'll say, the virtual background behind me, I know is one of the examples that our team, looked to early on. So Sharon, I'll start with you and kind of let you rip off of that.
Sure. Yeah, we definitely have done that, and some other fun things as far as backgrounds and tools for our teams to use. I think for me, the thing that we've worked on the most is really just trying to stay connected, and we have different team meetings that we are getting together on, but I also will just sometimes text someone or call them or FaceTime really quickly and to surprise them, if you will, just to check in. And then I'm beginning to see a little bit too, although all of our teams are doing amazing work, that it's really easy to be siloed again. And we work so hard not to be. So I'm beginning to sense that we've got to make sure that we're creating ways to bring those teams back together, even in a virtual sense. And so I think just to your point of having those happy hours and, having surprise birthday parties when we know someone's celebrating a birthday, doing all of those sorts of things is just to keep that human connection going.
And here
I'm sorry, I was playing a video that I'm going to share in the comment section in just a minute. One of the ways that we're trying to keep President Gee engaged, Sharon often jokes he has a to-do list every day. And we're a little concerned that he has discovered his mobile phone shoots video and he's using it a lot. But I'm going to share with you in the comment section one of the videos that we recently shared from him that speaks to his personality, how he's staying at home but still staying connected to the campus community. Jack, what about you and how your team is staying connected?
Yeah, so we've done many of the things that that you and Sharon had mentioned. We've started an online scavenger hunt. We started Fun Photo Fridays, which have different themes, and people can kind of post about those. And one of the things that we've seen is that everybody wants to contribute in some way. And it's been really difficult for some of our staff because they see people who are maybe on the media relations side or the social media side are just slammed. And maybe their program has had a lot of things canceled, and so they're feeling like I'm not pulling my weight, and so they have really stepped up and are doing these morale building, these connection building activities, which I've told them is just as important, if not more so, than the work we're doing, because it contributes to the overall effectiveness of our team and enables us to have a cohesive team. I think we may come out of this a more connected team in the end than before, because it's taken down some of those physical barriers. We had two main locations about a 10 to 15 minute walk apart from each other where our staff was located. That's gone now. And so you have a lot more interaction between divisions than you did beforehand.
All right, we have a few questions that are coming in on the chat section, so I want to get to a few of those. Mike Fulton is asking, and I'm not sure that we know the answers to this because I know this has been a moving target, but I'm going to throw it out there. How much financial support is WVU and the University of Washington getting through the Pandemic CARES Act? And what are the plans, or what conversations are you having on your campuses about how that money might be utilized? And how are you working with your state and federal government liaisons to make those kinds of determinations? Jack, I'll start with you.
Yeah, so I don't have the exact figure off the top of my head, but I know that there's conversations this week about the distribution of the emergency aid for students component, and how we make sure that we get that those funds to the students who need it most. In terms of our working with our state and federal partners, as well as our community partners, we've had beforehand a tremendous relationship with them, along with our tribal partners, and that has been strengthened with the UW's role as the leading health provider for the region. I saw Michael also asked about whether the CARES Act will be sufficient. I don't think anybody believes it will. We are incurring tremendous costs every day. We have not implemented any furloughs, and in fact, President Casey directed that there would be no adverse job actions during the period of the governor's stay-home order, which it will be about 6 weeks long if it expires on May 5th. We'll see if it does. So we have pretty tremendous expenses. Revenues are down by the tens of millions just in the housing and food services side alone. And so and when you couple that with with actual state revenue losses and what that can do to our state funding, it's very clear that there will need to be additional federal support if we're going to be able to avoid some serious implications for our institution.
Sharon, I assume that that's pretty much the same situation at West Virginia University.
It is. We're working, we have to Jack's point, we have a close relationship with our government leaders as well, and our government relations team has been working closely with them, but we're still waiting to get some clarification on some of the ways we can use those dollars. And to Jack's point, it will not be enough. We will need to figure out how else we can find funding.
I'm going to skip down to Emily's question that just came in because it's sort of related a little bit to this, and then I'll jump back up to Sean and Heather and Caitlin's questions. But Emily was asking if universities are anticipating decreases in enrollment for the next year, and how are you adapting strategies to try and accommodate for those potential decreases in enrollment?
Yeah, so I can take that one first. It's really hard to say. I mean, it depends on where we are as a nation and where we are with how we are managing this virus. We anticipate there will be some change. I think it depends a little bit on people's financial situations and how we come out of it economically. I think we're finding that, based on the two scenarios that are most closely related to this, was either 9/11 or the 2008 financial crisis, students either stay closer to home or because of financial reasons, they chose a different option for higher ed learning. So it really, we're taking those two models and trying to talk about the value that higher ed still brings, looking around the clock on how we can provide as much financial aid assistance as possible to our students. We push back deadlines. We're looking at next year's senior class. Most of them should have taken the SAT at some point this spring, and that will be delayed. And so how do you purchase names to begin to recruit new students? That will all change. So the environment is shifting under our feet as we work on it. But bottom line, we just keep doing that personal outreach and trying to plan for how it might look based on the model that we're presenting come fall.
Yeah, we get kind of a daily rundown of how many students have accepted our offer of admission. We're all closely monitoring those. The numbers have so far for us held up, particularly on the non-resident and on the international side. And what we've heard from our counselors in Washington is that any softness in the resident numbers is more just people being uncertain of what their plans are, and not knowing that they have till May 1st, wanting to see how things play out, since Washington was kind of on the one of the first states to go through this. But they anticipate that, as Sharon mentioned, we may see more students staying closer to home, which for us, when we have about 65-70% of our students from Washington, is a good sign. But for institutions that have a more even split between in-state and out-of-state students, that could be a challenge.
Caitlin was asking, how are you balancing producing normal content without being insensitive to what we're going through right now? And I think every communications office is having that same conversation. I know I'll say that from a news perspective, I haven't received one inquiry from a news outlet or a reporter in about 6 weeks that wasn't related to COVID-19 in some way. So our process has been, if it's non-COVID related, it has to be a very high level announcement if we're going to call attention to it. But that doesn't mean that some of those communications that are necessary don't end, but we just know they're not going to get the same kind of public attention. So we're not placing additional emphasis on those right now. So it's really more a matter of where are we putting the most resources in terms of pushing out those communications, even though we know they're important. We also know they're not going to gain a lot of traction right now. But Jack and Sharon, interested to know if as it relates to more of the marketing and some of the other things that just sort of have to happen if you're having those same conversations.
Yeah, I mean, we definitely are. We had a conversation a couple of times last week about this week's homepage feature, which if you go to uw.edu, you'll see it's about our Q Center. And that's a feature that we've been working on for many months and had held for weeks due to the pandemic. It's the first homepage feature not about coronavirus that we've had in 5 weeks. All 5 previous stories were in some way about the coronavirus or a response to it. And as we talked about it, we really kept an eye on both the national mood, but really in particular the regional mood. And we also wanted to play into what I talked about earlier about demonstrating the quality of education. And part of that is supportive centers like the Q Center for our LGBTQIA students. And so we made the decision that we're still going to have 2 of the 3 tiles on the homepage about coronavirus, but our big feature story, it was time for a really positive, really inclusive story that reminded people that there is this resource available even if the center is physically closed, because it is a challenging time for many of those students who have gone home and maybe they hadn't come out, and so they to their parents, and so they can't be their full selves at home like they could be at college. And so making sure that they knew that these resources were available. But beyond that, just helping to remind folks that this is the University of Washington. Yes, we have these outstanding resources related to the fight against COVID-19, but there's so much more than that. And so, April, while you're absolutely correct that on the news side, 95% of the inquiries are about coronavirus. On the marketing side, we are still trying to promote those stories that remind people of what a fantastic community the UW is, because eventually this will end and we'll all be back together again. And so that's part of our efforts to keep people connected with the institution.
Yeah, and I would echo what Jack said, that we definitely have the new side of life that is all things COVID at this time, but we certainly have to continue to recruit our students, to connect to our students that we have currently in the pipeline, and remind people what WVU is all about. And so from a marketing perspective, we really haven't changed our messaging a great deal. We've changed the mode of delivery a lot. And we probably put a little bit more emphasis on safety and some of the research activities and things that are happening. But for the most part, you're right. From a news perspective, it's all things COVID. From a marketing perspective, still trying to build the brand and help people understand how they can connect with the university.
As we move into the last few minutes of our session, I want to make sure we get to a couple of the additional questions that we have. So one of them relates to social media, and I just shared a link, by the way, with everyone in the chat section with one of those recent Dr. Gordon Gee Twitter videos. This one is about some of the favorite books that he's reading right now. And so that leads me to a question from Sean, looking at whether we've seen a shift on campuses in how we measure the success for social media versus maybe a few months ago, looking at click-throughs, and have the goals for your messaging and tone changed as it relates to your social media engagement during this time? I'll start with you, Sharon, on this one.
Okay, so yeah, that's a good question. I'd have to go to the team to find out the stats and our numbers, but what I can say is that the social team has been so crucial in getting messaging out and in helping to dispel misinformation that is floating. And so that team has been on 24/7 of just trying to constantly monitor what is being shared and keeping the accurate messaging out there and at top of mind. I think from our tone and tenor, I don't know that we've changed that. It's the same voice and the same sort of means that we would typically put out social media. It's just really all wrapped around the virus and how we can combat that, how we can practice social distancing, trying to put out means and messages that relate to each audience, whether it be an alum versus a student versus a prospective student. So I think for the most part, we have leaned in on that team, probably even more so during this time, just to make sure that we're getting the right information into the right hands and correcting misinformation that's being put out by others.
Jack?
Yeah. I mean, that's a fair representation of us as well. We're a lot more community management than we had done before in terms of responding to inaccuracies and whatnot. Whereas perhaps in the past we would have let some of those things go. Now, particularly if we're talking about things that affect health and safety, we're going to weigh in and try and get the correct information out there.
All right, let's move into a couple of process pieces. I know we had, one very specific question from Heather, which I think is a good question. As we start to look from, spring break, moving to this, alternative model that we're in right now, and then planning for summer and then what fall looks like, how have you handled something as simple as, what about students' personal belongings that they may have not had an opportunity to get when they were leaving for spring break and now have not returned to campus and may not be returning to campus for a long time. I know that that's something that at West Virginia University we've been asked about and we have addressed in our FAQ. But those are some, I think that's an example of the very minute detail that we're having to think through on all of our campuses. So Sharon, I'll start with you and then Jack, you.
Sure. So to that question in particular, we have the stay-at-home order from the governor, so we can't be moving around, and so students aren't able to come back. So we've just reassured them that their things are locked and safe and secure. If they need something in particular, early on we worked with our RA staff to get things boxed up and shipped if they really needed something that they left behind. So the student life staff has been incredible in just reaching out and meeting the needs of the students and handling it that way. But you're right, there's so much minutia that really is going into every single little decision that when you pull one string, it affects another, and it just keeps, kind of piling on. I think that the way we're approaching it is it's sort of one day at a time and 1 month at a time. So we know, for example, that we're not going to be able to hold events in June. So all things have been canceled for June. And in this month, we'll take a look at what the medical community is saying, and we'll decide for July. So it's just, it's both short-term, long-term, immediate term planning all happening at the same time.
Yeah,
Jack?
I mean, our experience on the housing side is pretty similar. So I would flag for this group that one of the things that we're starting to look at now, and that hopefully you all will be as well, and you all be at the table with your leadership when you do this, is how do we restart? How do we start to bring people back to campus? Will definitely be some sort of phased approach. I expect that I'll be working from home for quite some time because I don't need to be on campus to do that. But how do we bring people back and ensure social distancing? How do we bring people back and have, health attestations that, you don't have a fever that day, you don't have any of those symptoms? As Sharon said, when you pull a thread, things really start to come apart. Open records laws. If I attest to today, I don't have a fever, that goes in my HR record for 7 years. And so do I really want my boss knowing my health conditions? And so there's all these things that we're just now being, kind of forced to reckon with, and that I think we'll continue to do so as we, open up to the extent that the public health guidelines allow us to, but also stay ready to clamp back down if we see a resurgence in the outbreak, which is entirely possible until there's a vaccine online. And so, having communications at the table with that is vital. We're very fortunate that we have a leadership team that views communications as vital so that we can help them work through, the second order effects of, okay, well, if you do say this or we take this action, these are the questions that are going to come up, and how are we going to address those? Having communicators at the table, especially at a time like this, is just critical.
I would certainly echo that thought. And we are just now coming up on 1 o'clock. So quickly, I wanted to give both Sharon and you, Jack, an opportunity. If there's something we didn't touch on that you think is really important, please feel free to share that. I want to make sure that we address it if that's the case. I think we covered a lot, though.
We did cover a lot. I think I would just echo what Jack had said earlier, that the role of the communication team is so vital and important in this time. And I think if there's ever been a moment where we can feel really proud about what we do and the role that we play in not only society, but our university, it's this moment. We've all done an amazing job in keeping folks aware and informed and able to make the right decisions for each person.
Yeah, I'd echo that, and I'd echo my thanks at the beginning. None of us signed up for this, at least this exact thing that we've been doing, that it has consumed our lives. But I think we can all take pride in our role in this. We're not, I'm not a healthcare worker. I'm not there at the hospital, or not there doing contact tracing, or not in our facilities crew. So I have the luxury of working from home. But as communicator, I do feel a special, both a special responsibility and a special pride in what our team has been able to do during a very challenging time, not just for our community, but for them, many of them personally, as they navigate working from home, caring for loved ones. and whatnot. And so I know that that is something that you are all facing as well. And I really thank you for the service you're providing on behalf of your communities.
Thank you so much. Thank you for joining us, and a special thank you to Sharon and Jack for sharing their insights and experiences. Be sure to visit integrate.wvu.edu for upcoming sessions, recordings of previous episodes, and to subscribe so you receive important updates. Thank you all. Have a wonderful, safe, and healthy day.